Turner. I'm president of Minnesota Nurses Association. More importantly, I'm a night shift nurse at Northmore and Robbinsdale. I got my peeps here. Yep. On that hospital's first COVID ICU floor. So I've been living the dream since the beginning of March, like a lot of us. Everybody on our floor is intubated. Everybody on 2 of our other floors are intubated with this COVID business, okay? This is real. This is a safety risk to all of us. So we're here. We're here today because we're not getting the protection we need. My favorite saying right now is they say there's enough PPE. There's not enough PPE when we've been rationing from day one. That's a contradiction of terms to say that there's enough when we've been rationing from day one. And so we're going to have the United Chair come up here and give our list of demands. But I want to say how proud I am of all of you for standing up and fighting. And this is only the beginning, because this problem isn't going to go away. We need to fight for safety. We're the ones keeping the people of Minnesota safe. But we can't do that if we're not here. Right. So we're fighting for everyone. They may not realize it. We get it, the economy, they want to get it going, but not at the risk of the frontline workers. So once again, thank you for coming from all over. We've got people from out of the metro. We've got people from, we got nurses that actually crossed the river. From over to Robbinsdale and Plymouth. Bravo, we don't do that very often. And I want to once again thank each and every one of you. And now I'd like to call up Emily, who is the United Chair, who's going to read the list of demands.
Well, I just broke that. Hi everyone, I am Emily Cipolla. I sort of thought that I'd be talking to 40 of my coworkers and friends, so this is awesome to see. So it's a little bit easier for me to read with a group this size, so that's what I'm going to do. Like Mary said, I'm Emily Cipolla. I'm one of the nurses and union chair people at United, along with Brittany Livicari and Bunny Engeldorf. Who is right? All right, it's very powerful to see so many people here at once, yet spaced out safely. As you can see, we are serious about safety, because we all know that if nurses and other frontline workers get sick, we can't care for patients like we are meant to. We have taken extreme measures here to maintain social distancing, with sections of rope, cones, chalk marks, masks, and double the amount of marshals to make sure that people are social distancing. We're standing on the grounds of the Capitol to demand the same treatment from our employer and our government. Here are our demands. PPE at the highest level of protection. Nurses involved at every level of decision making. Environmental readiness of COVID positive units. And last but certainly not least, immediate retraction of any disciplinary action against nurses who have demanded PPE or other safety precautions.
All right, now I want to bring up to the mic President Jamie Cowley of Seiu Healthcare, Minnesota. This is the people, these are the nursing assistants and the food service and all those people that are so important.
Thank you, Mary. And I just want to give yourselves a big round of applause for all of the care that you give at United Hospital and in every hospital here in the metro area. We're right alongside you. SEIU members, we're pharmacists, we're surgical techs, we are food service, we are everything, including the linen workers at the co-op. who want to clean the scrubs that you want to wear so that you can do it safely. I'm here to call on Allina to reinstate the nurses, to get you the PPE that you need, and to work with all of us so that we can give the care that we need in the hospitals, in the nursing homes, and in the clinics of this state. We need PPE. The first letter that we sent to Allina Hospital and everybody else about the coronavirus and protecting our workers was on January 28th, 2 days after the first case in this country. And here we are 4 months later, and we still don't have the PPE that we need. You don't have it, we don't have it, and it's past time that we get what we need. Give yourselves a round of applause. Give Mary Turner a round of applause. I serve on the COVID task force with this state along with Mary Turner as a voice for workers. And Mary is a vibrant, loud voice, passionate voice. You should be very proud of the leadership that you have in your president, Mary Turner. I'm proud to serve with her. I'm proud to stand by you. Get us the PPE we need.
All right, I'd like to call up here because this is a very special man that is here to represent the Senate, Senator Jeff Hayden.
Good evening, nurses and healthcare professionals. It's so good to see you out here. As Mary said, my name is Jeff Hayden. I am the state senator at Senate District 62 in the heart of South Minneapolis. I want to first of all, take a moment to thank all of you nurses, especially those working the evening or night shifts that can't be here tonight. I'm glad that you're out there. You're at the forefront of keeping Minnesotans safe during a public health crisis we've never faced before. There's no amount of words that are sufficient enough to show the gratitude because you're making unimaginable sacrifices and taking risks to care for Minnesotans. If anything, we need to show our gratitude through our actions. And the least we can do for nurses across the state is to ensure workforce safety. Kind of hard talking to this mask guy, don't you? Poor baby guy, yeah, I know, the mask is going to get his face. Since the crisis began, the legislature has provided $400 million in help to ensure our healthcare system has the resources it needs to respond to COVID-19. A primary purpose of that funding was to ensure we had adequate personal protective equipment, PPE, for our frontline workers. You have spoken, we've heard your concerns about the current PPE allocation not being adequate. I assure you we're going to work to be strong partners to ensure every nurse has what it has to keep them and their families safe. No one should fear for their safety or fear unfair retaliation for voicing health and safety concerns. Now is not the time to relax safety standards or jeopardize the high standards of care that Minnesotans need. Instead, frontline care workers should have the PPE that they need and the safety they deserve in order to protect the workers and the patients. We in the Minnesota Senate here in the DFL are with you for this fight. We look forward to being strong partners to ensuring that nurses everywhere have the protection that they need. Thank you guys so much for being here.
All right, our last labor leader I'd like to bring up is Cara Peterson. She's the St. Paul Regional Labor Federation president.
Good evening, everyone. My name is Cara Peterson, and I'm the president of the St. Paul Regional Labor Federation. Our federation represents over 150 affiliate unions and more than 56,000 union members living in the Twin Cities East Metro. Our federation consists of public employees, folks who work in retail, people who work in restaurants, in manufacturing, and in construction, and of course, our federation includes people who work in healthcare settings, like members of the Minnesota Nurses Association and Seiu Healthcare Minnesota. People have made a lot of sacrifices over the past couple months. Some haven't been able to work since mid-March, and it may be many more months before they're able to return to work full-time. But some folks are coming back to their jobs, and even more will be returning in coming weeks. So now's the time for us to focus on workplace safety across the board, to follow social distancing guidelines like we are tonight, and of course to wear our face masks. Community members should do these things to help protect public health and to lessen the crisis facing frontline healthcare workers like all of you. And employees should do everything possible to ensure that workers are safe on the job. We know that corporate healthcare prioritizes profits over patient safety, so we're joining our voice to the demand that all workers, including nurses and healthcare workers, have a real voice in decision-making related to workplace safety. We're demanding that workers have access to the tools that they need to be safe on the job, and for healthcare workers, this includes access to PPE. And finally, people who don't have safe work conditions and take action shouldn't be punished by their employers, and they shouldn't be fired for shining a light on the flaws in our healthcare system. Nurses and healthcare workers are fighting every day to protect the health of our community. Your work is always important, and right now it's righteous. And the labor movement will stand with you as long as it takes.
Now we're going to bring up a series of nurses from United. We're going to start off with Leaf Doriscar. Did I get that right? From the emergency department. He's wearing some fancy PPE here. Fancy PPE.
Good evening, my friends. In March of 1995, sarin gas was released onto a Japanese subway, injuring nearly 1,000 people and killing 12. Because of this heinous act, every major hospital now stocks a required level of atropine determined by the Department of Homeland Security. A much more likely occurrence would be a pathogen that is both highly contagious and can incubate without symptom before turning deadly. We as a global community are currently learning this lesson the hard way. It is a lesson the healthcare system failed to adequately prepare for. Despite lack of preparation, protection, and communication, bedside workers braved the unknown monster that is COVID-19. We put ourselves at risk because of our care for the patient. We want to heal those around us, our patients and our communities. We put on old masks because of our belief in the needs of the many. Healthcare workers did not choose to have less than adequate supplies. We did choose, however, to reuse and reuse and reuse so our fellow caregivers could also have enough. We now stand at a pivotal moment. We not only as healthcare workers, but as a society, are faced with a monumental decision: to return to the status quo or to build something better from the lessons our failures should teach us. Hospitals have failed to prepare for a public health crisis. The hospital industry then exerted lobbying pressure on the CDC to relax safety guidelines. Because of these relaxed guidelines, hospitals now have less pressure to secure adequate levels of PPE. When questioned by healthcare workers, the hospitals state they follow the guidelines set forth by the CDC, the very guidelines that were eroded due to pressure from the hospital systems. This is a call to action. I am calling us to return back to the time of best practice and not possibly adequate practice. If we are to reopen our economy, we must first be willing to reinstate the utmost of safety measures because safety is non-negotiable. I am willing to give my life for this job. It is a calling that is at the core of me. But I am not willing to be harmed or die because decision makers based their choices on percentages and not on the lives of safety of their employees, their patients, and their community. These are the people who work from home where they are allowed to social distance and have never looked in the eyes of a COVID patient drowning in their own lungs. People who are okay with staff reusing masks over and over, but balk at the idea of stockpiling N95s because expired equipment is money down the drain. We are standing at a pivotal moment in history. It is a time where the entire world stands together against a common enemy. We don't want to be heroes. We want to safely do our job and not spread this disease. I implore anyone willing to listen, help us to secure increased protections so we can in turn safely protect you. Thank you.
I'd like to now call up from the Labor and Delivery Department at United, Vanessa Armstrong.
Good evening. My name is Vanessa Armstrong. I've been a nurse at Allina for 21 years, and I've been a labor and delivery nurse for 14 years at United Hospital. Pregnant women and their newborn infants are a vulnerable population. These families deserve a safe environment and the highest care that we can give them. Every one of our doctors and nurses are doing our best to deliver the highest quality care. But 11 weeks into this pandemic, we're still not being as safe as we should or could. 2 weeks ago, our protocols changed to indicate that all pregnant women admitted to the hospital should be tested for COVID-19. To date, only some of our clinical sites are testing, and only symptomatic patients are tested at the hospitals. The vast majority of other hospitals in the metro area have been testing every OB patient for the past month. Allina stands out for refusing best practice guidelines of the obstetric profession. During this time, our repeated requests for testing and a concrete surge plan have been met with a stiff arm response. Recent research from 2 hospitals in New York show that 9 out of 10 pregnant women had no COVID symptoms when they were first admitted to the hospital to give birth. 86% of pregnant women with COVID-19 present with only mild disease. We know that the viral load in asymptomatic patients has been found to be similar to that of symptomatic patients, which suggests that not testing every patient potentially risks transmission to healthcare workers and other patients. All of the major medical authorities and journals made a joint statement at the end of March to use N95 during the second stage of labor for all patients due to the high incidence of asymptomatic patients. But Allina has decided that we do not need the protection of N95s in all but a few procedures that are deemed aerosolized. The second stage of labor can last 3 to 4 hours. During that time, labor and delivery personnel are in close contact with patients, exerting extreme effort, and frequently blow out their breath, cough, shout, and vomit, all of which put the healthcare team at risk, considering that COVID-19 transmission occurs through aerosol generated by coughing and sneezing. This is no time to leave a nurse unprotected from potential contamination of COVID-19 by an asymptomatic patient. In order to slow the spread of this virus, we need to limit the number of people who are in contact with COVID-positive patients and make sure that they are properly protected when caring for them. We cannot do that if we don't know who is positive. We need testing for all OB admissions now, and we need to use the highest level of protection when taking care of these patients. Nurses have been so concerned for our safety and for our families, we have had to react by using our own personal N95 masks, which has resulted in retaliation and threats of discipline by management. Healthcare workers should never be disciplined for demanding the highest level of protection against highly contagious communicable diseases that can threaten the life and health of themselves, their families, or their communities. We are essential. We are not expendable.
Great job. We've got an all-star lineup, don't we? All right. And next, we're going to hear from PACU, Shannon McCarran.
Okay, I'm not very good at public speaking, so I apologize. I am reading this letter written by a coworker on behalf of all of my fellow nurses that work in Peria. This letter will outline our surgical department at United Hospital over the past week. We have recently begun to increase our elective surgeries. Staff were notified and encouraged that safety would be of most importance for both employees and patients. Patients would be screened via telephone to ensure a negative COVID-19 result prior to their arrival to the hospital. We were also assured by management no patient would have surgery unless they had a negative COVID-19 test result. Many of our patients arriving for surgery, however, are not being tested for COVID unless they are symptomatic or if their travel screening indicated that they were high risk. Last Wednesday, May 13th, the surgical department had 10 patients arrive to the hospital without the required screening. It was decided the day before to retest these patients at 5:30 in the morning and get the results within 90 minutes. So staff arrived at 5:30 a.m. They were informed that these patients needed to be tested, and lo and behold, there was only one nurse that even knew how to swab these patients. So she had to swab multiple patients. The nurses that were performing the swabs wore N95s and face shields, and were told by management that that was not necessary. But the nurses wore them anyways because we know that we needed to. Some patients did not go into surgery without a COVID test result back. Consequently, many of the staff became very anxious, upset, and concerned. This is happening more frequently with the system being backed up and test results not available. As a healthcare worker, I pride myself, just as many as you do, on providing the safest care for my patients and for my coworkers. When the policies and recommendations in place are not followed or changed to meet the needs of the hospital, the health of patients and all staff are put at risk. We've had one positive patient that came back after surgery because she went in without her test result being back before she went in. Multiple staff were exposed to her, and none of their names are in the chart because they were just helping the nurse. So those nurses were not even notified that they were exposed to COVID. So, in closing, we have brought our concerns to management many times, and it's very condescending, argumentative, and combative, of course, when we bring this up to them. Staff have been harassed, bullied, and intimidated for choosing to wear N95s that they got from their own fit testing and their I understand that policies are constantly changing as this pandemic evolves, but it is setting up our staff for failure on many levels. And there is never a time for error in medicine, and especially when dealing with a novel virus. From an employee's perspective, it seems that administration is rushing to get these surgeries completed at a cost to its staff and patients. The point is that they are taking shortcuts, making bad decisions that risk staff and other patients, and chastise us for using our own clinical judgment. The governor's directive is to have patients tested prior to surgery. It's in the guidance document that they put out. Allina knows better. Please help Peria nurses.
Are any of you getting angry? Just checking. All right, I'm going to call up now from the emergency department, Cowley and Cliff Williman.
Okay, we're the soft part of the evening programming. So for one, my name is Cliff Wilming. In my mind, I'm still an employee at the United Hospital ER, as I've been all winter long. You know, so for one, I was talking about this with my son, Charlie, who's 10 years old, and what he was telling me today is that he said that the people that brought us to this absolute crisis, that are risking the lives of all of these good healthcare workers and the public, are getting away with almost everything, and the healthcare workers that are risking their lives to save the public are getting written up in reprisals and punitive measures. And Charlie's he's a sensitive young man, and he said that seemed all upside down. And so Charlie and I decided to put the world right side up, and we decided to start writing up management on some charges of our own. So we're going to get a little personal here because that's the way it feels at my house. And so first of all, I'm going to list Kelly Johnson, the ER manager. And Charlie and I wrote her up for harassment of ER personnel on issues ranging from hospital-issued scrubs to the use of personal electronic devices, violation of MNA members' Weingarten rights, and contribution to a general hostile work environment. And so as punishment, we decided that we would remove her from all management roles and permanently assign her to the yellow pod in the ER. Yes. For Sarah Krieger, the president of United Hospital, we have charged her with overseeing of retaliatory measures, including the firing of 2 MNA stewards. Now the other one is Monica right here behind me. Verbally admitting in a recorded interview that no one could have dreamt a pandemic could be occurring despite years of warning and notice. And tarnishing the United brand that, I think we're out here. Oh no, here we are. Tarnishing the United brand that her frontline staff are now risking their lives to maintain. And as a punitive measure, we decided that she should be subject to immediate removal from all healthcare decision-making and transfer to housekeeping duties on the COVID unit of United Hospital. And finally, not to leave Penny Wheeler out because she knows you want some attention as well, the CEO of Allina Health, for blindly leading thousands of frontline workers into impossible working conditions with little or no PPE, for overseeing the attacks on union nurses forcing the 2016 MNA strike, and for using the Allina healthcare system as her personal cash cow and a source of wealth generation, we are issuing Penny Wheeler a verbal warning. I'm just kidding. Immediate termination and forfeiture of all her ill-gotten wealth, and these funds to be used to build a healthcare system owned and run by the only people that matter, the frontline workers and the communities that we serve. Thank you, and here's my good buddy, Zeke.
My name is Cowley. I am an RN at United in the Emergency Department. I am likely to be the 3rd steward fired. I have my next disciplinary meeting for wearing the hospital-issued scrubs on Friday. My discipline is progressive, and in all likelihood, I won't have a job by next week. And why? Because I'm standing up. Because for years, as a part of unit council, I have been involved in negotiating with Allina over workplace violence, over the lack of appropriate education for staff, over so many safety concerns, and I'm done. This is it. I cannot negotiate anymore. This is where I stand. They have a clear pattern over years of not caring about their nurses, not keeping their nurses safe, not keeping any of their frontline workers safe. We are disposable to them, and I say that we are not. None of us. Not any of us. Allina, like all health systems, have known that a pandemic was likely to come. There have been reports for over 15 years, and some of those reports even tell them how much PPE they should have been stockpiling. Yeah. But that would be inconvenient. It would cost them money, and they're into making money at the risk of our lives. And it is shameful. And I'm done. I will continue to wear the hospital-issued scrubs so that I am not taking contaminated scrubs home to my family and my community. I'd like to say to Sarah Krieger that when I wear an N95 for 5 12-hour shifts, it doesn't matter if it sits in a paper bag for 5 days, it is not brand new. It is not like new. I think that's all I have. I prepared nothing, so I don't have a good out.
right, now I'd like to call up Monica Norberg, Neuro ICU.
And COVID ICU.
And COVID.
Yes,
Okay.
and COVID ICU. So, I've worked for United Hospital as an ICU nurse for almost 4 years. In those 4 years, I have been in good standing the entire time without any warnings or disciplinary action against me until May 18th, this past Monday, where I was terminated for doing my virtual mandatory stroke education at home. This was during a pandemic with a stay-at-home order in place. Prior to me doing my education at home, I made management aware that they were directly violating the stay-at-home order. I was ignored. Now, I've worked in the COVID unit mainly, specifically the COVID ICU. So any chance that I have of not exposing myself means that one day I may be able to see my family again, that I may be able to hug my mom. But with the current policies that they have in place, I can't do that. All of us are at risk. I was actually elected an M&A steward for the COVID ICU and the Neuro ICU. That was just 6 days prior to my termination. Some say that I broke a record. United. I personally, before I became a steward, voiced multiple safety concerns to management since the beginning of this pandemic and prior to it. From the education policy to PPE shortages to staffing cross-contamination concerns. We are being told that performing education in designated areas allows for social distancing. One of the recommended areas that I was told is the library at United Hospital, which is so close to the COVID ICU, you can see it from the anteroom. You can see the anteroom from the library itself. In fact, if a patient needs to be transferred to our unit from the ED, they are taken directly in front of the library in the west elevators. Clearly, this is a higher risk of exposure than staying home, like the governor wants us to. Another example of the PPE shortages that we've been experiencing, especially in the COVID ICU, is something that I never heard of until this pandemic, but it's called a shared PAPR. I personally cannot wear an N95 due to medical reasons, and so I'm given a personal negative airflow unit. I am not given my own. I have requested it multiple times from management, and I never received one. In fact, the one that I was wearing on my last shift in the COVID ICU, the PPE team called me and told me that they needed it in the morning for elective surgery. We are not being asked, we are being told what to do. This is not collaboration. This is authoritarian from management. But this is why we are here. We have witnessed, as healthcare workers, the hazardous conditions firsthand. And we have chosen to be here and not give in to fear. Because we will not remain silent. That is not what we do as healthcare workers. We cannot remain silent for the safety of everyone. Thank you.
And last but certainly not least, Jean Ross, our National Nurses United President. Hello, everyone. She's right. I am Jean Ross. I am the National President. So I bring with greetings from over 150,000 nurses across the country who are going through just what you are. And you've got a great deal of empathy and a great deal of sympathy. They're sending their well wishes your way. We also belong to a group called Global Nurses United, which has been very, very helpful during this pandemic. And what we have from our friends in Global Nurses United is their utmost sympathy, because we are doing worse than almost any other nation on the planet. It doesn't make me feel proud. I always have felt proud coming from Minnesota. Healthcare is big, right? We'd be flyover land if we didn't have our own little things. And one of them is healthcare. It's always been important to us. So I was listening to all the stories here from these nurses at United, and I want the people that are non-nurses, non-healthcare workers out there to know that this is true at every hospital, not just in this state, but across the country. And what do we know about that? I have to tell you, I've been a nurse for over 40 years. I have been a Minnesota nurse, an M&A nurse since I got my license. I've never been prouder to be in this union and to be a union member, period. We have other wonderful union allies with them, and I'm thankful for every single one. So I want to start by just saying, the nurse who was up here with the plastic bag from the ED, what's your first name? Hey, you spoke very well, thank you. But I take issue with one thing you said. He said that all it took was pressure from the Hospital Association, and the CDC changed its guidelines, and that's not true. There was no pressure. They crooked their little finger, and the CDC crumbled. That's right. This is pressure. This is pressure, what we're doing. Marching however long it was, I have to tell you, I'm getting older. I had to literally be pulled up by that rope, because I was at the end of the line. I want to read something to you. I was going to paraphrase, but I started my day with the Star Trib here, and I think it deserves not just paraphrasing, but verbatim, because it just struck me so. It was an article on today's action, right? It's from Mary Krinke, VP of Government Relations for the Minnesota Hospital Association. And here's what she had to say. Under normal situations, you probably wouldn't say that a rain poncho would make a very good gown. But according to the experts, a rain poncho actually protects employees pretty darn well. Now, what medical experts did Mary Krinke check with?
Poncho makers.
Poncho makers. And I bet they do a damn fine job of keeping the rain off you. But they will not help you with COVID. They will not. I've been thinking about what I've learned through this pandemic, and I'm sure a lot of you have learned the same things. One of the things I've learned is, as always, the public has our back, and we have theirs. And that's wonderful. To the public, we are indispensable. To the government, to our employers, we are sacrificial fodder. Sorry guys, that's what we are. If they meant what they said about caring about our safety, they would act like they did. And they do not. So don't fool yourselves. I've listened to younger nurses talk about how they realized, and it was a big shock to them, that there was no collaboration with their management, that they really didn't care. Well, and I feel bad because I remember I was quite young when I learned that myself. I was like 23, it didn't take me very long. First job. But I will tell you this, to quote Churchill, what we learn from history is we don't learn from history. We knew about this. Has anybody been following the news? I know you have to take yourself away for a while.
Who's been following the news? Did you hear the testimony of Dr. Bray? There isn't enough PPE and testing supplies. We are going to be up shit creek. We got to do something. No, we don't. We'll make other arrangements. We'll downgrade the CDC guidelines. We'll have them share. You guys, nobody is going to get you the adequate amount of PPE that you need, that we all need, unless you start demanding it. And when nurses ask me, well, what do you do? I know it's a single-use gown, so I throw it away and they tell me there isn't one. You look at that manager and, folks, you're brave. Everybody here knows you're brave. You look him in the face and you say, then you had better get me one, because I'm supposed to be taking care of that patient and I cannot enter that room. That is what we're going to have to do. We are going to have to demand it. We are not going to request it, and we are not going to beg. We are here to tell you we need it, and we need it now. The public is behind us. They will help. They have been, right? I've heard people say, and I will close with this because I'm sure you're all getting tired. I have heard people say, but the economy. Folks, there's no economy without customers. And there's no customers if they're lying in bed fighting for their life and your nurse is lying in the bed next to you. There is no economy. And I want you to carry one thing with you. Those of us who work for a living, the public, understand this. Our instincts at the very start of this pandemic were excellent. What did we do? We banded together. It's not social distancing, you guys. It's physical distancing. It's physical distancing we have to do, and we understand that. But we have social solidarity. Our instincts were good. The employer's instincts are wrong. The government's instincts are wrong. And it's up to us to save ourselves. Thank you very much.
Steve Ross, our national president. So this ends our program tonight. I want to thank you all once again for coming out. I do want to make an announcement. I think I see the M&A van over there, and that's where all the signs go, right, Carlton? The keeper of the instructions, yes.